The hidden link between infections and chronic diseases, a paradigm shift in public health. For decades, we've viewed infectious and chronic diseases as separate entities. But groundbreaking research is shattering this divide, revealing a shocking truth. Viral infections aren't just fleeting illnesses, they're silent architects of chronic conditions, particularly cardiovascular disease, CVD. This isn't just a scientific discovery, it's a call to arms, demanding a radical rethinking of public health strategies. A silent epidemic unveiled. Imagine a world where preventing a heart attack could be as simple as getting a flu shot. This isn't science fiction. A landmark study by Dr. Kosuke Kawai and colleagues at UCLA, published in the Journal of the American Heart Association in 2025, analyzed 155 studies and found a chilling link. Viral infections significantly increase the risk of cardiovascular events. Acute infections like influenza and COVID-19 can quadruple the risk of heart attacks and quintuple the risk of strokes within a month. Even long-term infections like HIV and hepatitis C leave a lasting mark, elevating the risk of coronary heart disease and stroke. The controversial counterpoint. But here's where it gets controversial. While science screams for action, some voices, like Robert F. Kennedy Jr., appointed by Donald Trump to lead the Department of Health and Human Services, are drowning it out. Kennedy, a vocal anti-vaxxer, champions chronic disease prevention while dismantling vaccine programs and downplaying the role of infectious diseases. This isn't just misguided, it's dangerous, ignoring the very science that could save lives. Beyond the heart, a web of connections. The impact of infections extends far beyond the heart. Research suggests a wide range of cancers, autoimmune diseases, and neurological disorders may be triggered or accelerated by infectious agents. A 2020 Lancet Global Health study estimated that infections contribute to a staggering 8.4% of the global burden of non-communicable diseases. COVID-19, a stark case study. The COVID-19 pandemic serves as a grim case study. While the virus itself caused over 1.2 million deaths in the U.S. by October 2024, the true toll is far greater. Excess mortality, the number of deaths above expected levels, reveals a hidden epidemic. Between 2020 and 2023, the U.S. experienced roughly 3.63 million excess deaths, many attributable to cardiovascular complications and other long-term effects of COVID-19. Long COVID, the lingering shadow. And this is the part most people miss. Long COVID isn't just fatigue. It's a spectrum of chronic conditions, from cardiovascular disease to diabetes and autoimmune disorders. Studies show that even a single COVID-19 infection significantly increases the risk of these conditions, with reinfections compounding the danger. This isn't just about individual suffering, it's a public health crisis in the making. Vaccines, not just for acute illness. The solution isn't rocket science. Vaccines, long seen as tools against acute infections, are emerging as powerful weapons against chronic diseases. Studies consistently show that vaccination reduces the risk of cardiovascular events associated with infections like influenza and COVID-19. The European Society of Cardiology's 2025 statement recognizes vaccination as a cornerstone of cardiovascular prevention, alongside traditional measures like blood pressure control. A call to action: science versus ideology. The evidence is undeniable. Infections drive chronic diseases, and vaccines are a vital tool in our fight. Yet, anti-vaccine movements, fueled by misinformation and ideology, threaten to derail progress. The choice is clear: embrace science and protect public health, or succumb to the dangerous allure of pseudoscience and watch our health systems crumble. The question that haunts us: will we let science guide us towards a healthier future, or will we allow fear and misinformation to dictate our fate? The answer lies not just in laboratories and clinics, but in the hearts and minds of every individual who values truth, health, and the well-being of our communities.